afternoon, Miss Rana. I am Glory Magbango from BSN A18, and I will perform lung and thorax assessment. First, I will gather all the equipment that is needed for this assessment. This includes stethoscope and the patient's gown. Good afternoon, sir. I am Glory Magbango, your nurse for today. Sir, to verify your name, your identification, can I ask for your full name?
MRP Magbango.
Okay. Your birthday?
October 3, 1991.
Okay. Your age?
30 years old.
Okay. What is your preferred language po?
Tagalog.
Okay, Tagalog. For this assessment for today, sir, I will be assisting your thorax and lungs. For this assessment, I need to inspect, palpate, percuss, osculate, and listen to your breath sound. Is that okay, sir?
Okay.
Okay. Rest assured, all the documents that I have gathered will be confidential between me and the attending physician. Okay, sir? After that, I will perform hand hygiene by washing my hands. After performing hand hygiene, I will provide the privacy. Sir, wait a minute, sir. I will close the doors to provide privacy. After assisting the patient to undress if needed, and provide a patient's gown, assist the patient to a sitting position and expose the posterior thorax. Inspect the posterior thorax, examine the skin, bones, muscle of the spine, shoulder blades, and back, as well as the symmetry of expansion and accessory muscles during the respiration. Sir, can you... Okay. As I inspect the thorax of the patient, there is no scoliosis and there is no lesion that I observed in his thorax. Okay, sir? Can you breathe in? Okay, breathe out. Breathe in. Breathe out. Breathe in. Breathe out. This is the anterior, posterior, and lateral diameters of the thorax. Okay. After that, palpate the spine of the posterior thorax. Use palmar surface of the hand to palpate for the temperature, tenderness, muscle development, and masses. Okay, sir, can you tell me if there is pain as I palpate your back? Okay, sir?
Okay.
2, 3, go. Right here po.
Wala.
Right here.
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 Wala.
Right here. Right here.
Wala.
Okay. We will check the temperature of the patient's thorax. Okay. the thorax, the posterior thorax of the patient's temperature. It is warm and it is normal. And as I've checked, while palpating, there is no masses that I observe in the patient's body. Next, I will instruct the patient to take a deep breath. Assist for the tactile primitus by using the ball of the hands to palpate over the posterior thorax while the patient say 99. Okay, sir? As I will assess your tactile primitus. Take a deep breath as I touch your posterior thorax, and as I touch it, you will say 99. Okay, sir? Okay.
99. 99.
Okay.
99. 99.
After assessing the tactile primitus, I will assess the thoracic expansion by standing behind of the patient, placing the both thumbs either side of the patient's spine at the level of T9 and T10. Ask the patient to take a deep breath and note the movement of the examiner's hand. Okay, sir? As I touch your T9 or T10, can you take a deep breath po?
Okay.
As I breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Okay? For the next step, percuss over the posterior and lateral lung field for tone using a zigzag pattern. Starting above the scapulae to the base of the lungs, note the intensity, pitch, duration, and the quality of the sound produced.
After percussing, we must note for the intensity.
Dito ka, pag sinama ka dito.
After percussing, oscillate the lungs across and the down posterior thorax to the base of the lungs as the patient breathes slowly and deeply through the mouth. Okay, sir? As I oscillate your thoracic posterior, can you breathe slowly as I touch the diaphragm of the stethoscope in your back? Okay? Breathe out. Okay. Okay. After completing the assessment for the posterior thorax, we will proceed to the anterior thorax. Okay? Yes, sir? We will rearrange your patient's gown. Okay, your hands, sir. Okay. Oh. Examine the anterior thorax with the patient sitting. Rearrange the gown as I do it earlier. The anterior chest was exposed. Then inspect the skin, bones, muscles, as well as the symmetry of the lung expansion and accessory muscles used. Okay. Yes, sir. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. After that, I will palpate the anterior thorax. I will palpate the tactile primitus as the patient spells the word 99. Okay, sir. Just like I palpate the tactile primitus, you will say 99 as I touch your body. Okay, sir?
Okay. 99.
Breathe in lang po. Okay.
99.
Breathe in, breathe out.
99. 99. 99.
Okay. You say, sir, 99?
99. 99. 99. 99. 99. 99. 99. 99.
After palpating the tactile primitus, we will percuss the anterior thorax. Okay, sir? Okay. After percussing over the anterior thorax, I will osculate the patients through the anterior thorax as the patients breathe slowly and deeply through the mouth. Can you breathe in deeply and slowly? You will release your air as I osculate your anterior thorax po. Okay. Out. Okay. Okay. Okay, sir. Inspect the breast and axilla with the patient's hand resting on the both sides of the body, then place the hips and then raise above the head. Okay? Sir, can you do it like this? Okay. Okay. As I observe that the breast is symmetrical and the axilla is symmetrical also. Okay, sir?
Palpate the
Sir,
axilla
can
with the
we
patient's arm resting
go
against the
there?
side of the body Assist the
Okay, sir,
patient into a
can you-
supine position.
I will
Place a
assist
small
you here.
pillow or towel under the patient's back.
Okay. Okay. Right side.
Palpate the breast and nipples.
Sir?
Wear glove if there is a discharges or lesion present.
After that, we will assist the patient into a patient's gown, then perform hand hygiene. Okay, sir? Okay. After performing hand hygiene, I will document the findings of the assessment. Okay, sir, as I observe, I inspect, palpate, and listen to your breathing and your thorax. There is no abnormality happens, and all of the things that I've gathered throughout the assessment, I will refer it to the attending physician. Thank you for your coordination, sir.
Thank you.